At 7:42, as federal health officials closely monitor the deadly Hantavirus cruise ship outbreak, the World Health Organization has revised the total number of cases linked to the ship, lowering it from 11 to 10. Meanwhile, the number of people being monitored in the U.S. has grown to 41, according to the CDC. The map on your screen right now shows where they are located. 2 of those people are in Maryland, 1 is in Virginia. But health officials stress they are only being monitored. There are currently no confirmed hantavirus cases in the U.S. But with concerns growing, the Johns Hopkins Hospital in Baltimore says its highly specialized biocontainment unit is now on alert. The unit, created to handle some of the world's most dangerous viruses, has been preparing for a possible case. You're looking at photos that show some of the training exercises staff regularly go through to prepare for these outbreaks like this. And to help us better understand the hantavirus outbreak, we are joined now by Dr. Gaby Frank from the Johns Hopkins Special Pathogen Center. Dr. Frank, good morning to you. We appreciate your time and thanks for joining us.
Good morning. Thanks for having me.
How concerned should people be about this particular strain of hantavirus right now? We've heard a lot about this Andy strain. How does this specific strain spread?
So to answer the first part of your question, I think that this is, at this point, and based on what we know right now, there is no risk for the general public. So this is something that is being monitored for people that were exposed either on the cruise ship or that on the plane with the other case. But there's not a risk at this point for the general population. And then when we talk about how it's being spread, when we talk about general hantaviruses, they're usually spread by contact with mice and the droppings. And this particular strain also has the possibility of transmit from person to person. So that's why those people that were in contact with the initial cases are the ones that are being monitored. Mm-hmm. But as you said, we have no cases confirmed in the U.S. at this point.
And can you kind of speak to the conditions on the cruise ship and why it was so easy for it to spread there?
That is going to be a hard question to answer because I wasn't there, so I cannot speak for the conditions, and that I don't have a report of all the epidemiological investigations on the cruise ship. But usually the virus spreads by close contact and contact with bodily fluids of people who are infected. So probably the people that were in closer contact, like sharing the same room or sharing like meals or sharing utensils, are at a higher risk than people that maybe were on the ship but were not sharing or were in different areas of the ship. So the concern is that it's a prolonged exposure because people are on the same ship, but not everybody that was on the ship will have the same level of risk. Although at this point, because we don't know that everybody is going to be considered high risk if they were on the ship, and they're going to be monitored.
Yeah. From the public perspective, there's obviously been a lot of concern that this is the next COVID. Health officials have repeatedly said that it is not. Can you talk about why this is different, though?
They're different family viruses, right? So every virus is different, and every viral family is different. And the way that they transmit will depend on viral characteristics, the people characteristics, and their environment. So this virus, although it's transmissible, is not COVID. And at this point, and based on what we know right now, there is no risk for the general public, so there is no need to panic.
Mm-hmm. What would have to happen for this outbreak to become larger and really a concern here in the U.S.?
That would be me speculating, and I don't want to speculate at this point. I think that the public health departments are doing what they have to do to maintain the community safe, and they are monitoring the people that have been exposed just to make sure that if anybody becomes sick, that they receive care at the earliest time possible, but at the same time that nobody else gets exposed.
Yeah. Can you kind of give us some insight in what's happening behind the scenes right now with your team when you see an outbreak like this? What preparations are being made right now?
So the United States has 13 different regional treatment centers for special pathogens. Johns Hopkins is one of those, and we all work collaboratively with all the different units around the country to not only be prepared to receive people that are infected with these viruses, but also to train our communities or our different hospitals within our regions for everybody to be able to identify and safely either care if they're going to keep the patients at their institutions or transfer those patients to us. So in order to be prepared, because those are not common cases, we do have to actually practice a lot to make sure that we keep the skills. And those are some of the pictures that you see. Some are that is actually from our unit, but probably there were some pictures from what we are actually training other institutions.
All right, Dr. Frank with Johns Hopkins, thank you so much for your time and insight this morning.
You're very welcome.
We appreciate it. 747 is